Hi friends, this is Dr. Materi and welcome to the School of Wellness. In this segment or this lesson, I'm going to give you a preview of what I educate all my new patients on. So if you come into my clinic, you're going to get this brief lesson. And the reason why is because I'm going to need to, more than likely, do a little bit of a shift in your paradigm. So you can have an understanding that you're thinking the same way I'm thinking, and we can have an appreciation for what it is in order for you to get well. But in order to get well, you first have to understand how your body works. And what's important is this, is that if you don't have that foundation of how your body works and what causes it not to be well, then what's happening, you're going to get lost in the I have pain or I have symptoms and get too caught up with treating symptoms and not trying to find out what's causing your body not to be well. So in order to find out what's causing your body not to be well, we need to first understand, well, what causes your body to work in the first place. So what is the most important part of your body or organ in your body that controls and coordinates everything? Well, that's your brain and your nervous system. So we're going to draw a picture over here. This is your brain, and this is your spinal cord, which makes up your central nervous system. And how your body works, or how it communicates, is as follows. Signals are generated in the brain, start from the brain, go down into the spinal cord, and of course they reach a certain point or different levels, and then these nerves come out from your spinal cord and then separate. They divide into certain branches and certain types of nerves that innervate different parts of your body. So some of the nerve may go to skin, and some of it may go to muscles, and some of it may go to organs, and of course some may go to glands. And in this case, if we have a proper connection from the brain to the body, all these parts should function at 100%. And that's the goal. The goal of going to any type of practitioner, regardless if it's somebody who practices holistic or whatever, the goal is to get your body to function as close to 100% as possible. That is your best chance of course, being healthy. And that's what we want to be, is we want to be healthy. So proper communication from brain to body is the precursor to being healthy and to being well. So this is our Physiology 101 lesson. So let's move on to some other factors that are controlling, which is structural parts. The brain is protected by a hard bone or a series of bones that fuse together and form the skull, protecting the brain. The vertebrae are a series of smaller bones that make segments that protect the spinal cord and the nerves that come out that innervate the rest of the body. Now, if these vertebrae are properly lined up, one upon the other the way they should be, anatomically correct, and they're moving properly, which is critical. That means they're able to move in all their ranges of motion without any hindrances. Their goal of protecting the neurological system will work perfectly. The problem is that if these vertebrae move out of their normal position, they can cause interference and then subsequently altering the neurological signal to the body parts. Okay? So how does this occur? Well, the first thing we have to understand is that we don't live in a perfect world, and in this imperfect world, there's something called stress. And this is something that you cannot avoid. We have to learn how to work around the stress in order to achieve the wellness that, of course, we're looking to achieve. Now, stress comes in three flavors. The first one is emotional stress, which is very, very popular, but seriously only affects your body minimally considering the other two stresses. The next stress is our chemical stress, and these are the stresses of different foods we eat or chemicals we put into our body, the air we breathe. Anything that comes into the body that's not naturally supposed to be in the body is going to cause a chemical stress. And then thirdly, we have our physical stress. And our physical stress is governed by something called gravity, which is something we can never get away from. And the physical stress is what plays a toll on affecting the alignment and position and movement of the spine. Once this occurs, which it always does, it will cause a misalignment, or what we're going to learn as a subluxation in the spine, that will cause this neurological interference, setting forth a number of health problems or potential health problems from occurring. Okay? Now, the first physical stress that we undergo, and everybody, this happens to everybody, this is something that nobody could avoid, is just the fact that we're born. In the delivery process itself, when we're pulled from our mother's womb, there's a very good chance that the upper part of the neck, the upper cervical spine in your neck, can be knocked out of its normal position, for lack of a better terminology. When this occurs, it can cause somewhat of a laxity or a misalignment, leaving those first two vertebrae out of normal position. And in a later lesson, we'll explain more of the critical nature of having upper cervical subluxations in your spine. But for this argument here, we're just going to say that just birth process itself can begin the process of causing a misalignment of the vertebrae. Then, approximately maybe somewhere between 9 months to 12 months later, we learn to walk. And how many times are we up and fall and up and fall? And eventually, we learn to walk, but at the price of causing an imbalance, probably in the lower part, maybe the lumbar spine, or definitely in the pelvic area. This can explain probably 90% of why a person, just in general, will have one leg longer or shorter than the other, because of the imbalance that occurs in the sacroiliac joints of the multiple times we're falling just when we're learning how to walk. Now that's just in the first 12 months. Now all the other stresses, car accidents, slips, falls, talking on the phone, the way we sleep, being overweight, not exercising, trips, athletic injuries, over time these vertebrae move out of normal position and cause pressure on top of the nerve. In some cases, we can get pain directly in that area where that nerve is being pressed upon by the vertebrae being out of normal position. But more than likely, we're going to have this neurological interference, and when that signal reaches the skin, it can cause the skin to have some type of what they call paresthesia, maybe tingling or numbing or numbness or burning. But nonetheless, the skin will give some type of sensation which is different than what it should be, and that's a paresthesia. The muscles at the end of that nerve, well, that's a good chance of that muscle going into a spasm. And that can explain the headaches, the backaches, the shoulder pain, the neck pain, all just the soreness in the spine, because the body, the nerves are being interfered with, causing the muscles to go into a spasm, and then the muscles going into a spasm to try to prevent the vertebrae from moving further out of place. But here's where it gets critical. That same nerve, when it goes to the organs and glands, will cause these organs or glands to either increase or decrease function and eventually malfunction. So a gland can overwork or underwork, or overproduce or underproduce hormones or chemicals. Organs can either work in a hyper state or a hypo state. And this malfunction will definitely, over time, lead to its own set of symptoms. Now, the symptoms that can occur are things that are very common. Anything from a migraine headache to asthma, allergies, or some other type of problem that we would consider as high blood pressure. Not that we're going to be treating the end result symptom, but clearly we're going to be looking to the spine to see if there's any possibility that we can correct the imbalance in the spine to remove the neurological interference to allow the body to improve its overall wellness. This again, this imbalance in the spine is called a subluxation of the spine. That means the vertebrae is moved out of place, causing neurological interference and affecting the function of the body. Now, typically, what people do is this, is because we're trained medically. When we have these symptoms, we're going to go and say, oh, something's wrong with me. We're going to go to our family doctor, our medical doctor, and he's going to run some tests to see what is possibly wrong with you, and then come up with a diagnosis, and then 9 out of 10 times come up with some type of medication treatment plan, some type of pill, in order to what? Treat the symptomatology. To either cause the symptoms to either slow down or to eradicate them completely. There may be things that will relax the spasms in the muscles. There may be something that if it has an organ malfunction, if the organ is functioning too fast, maybe the medication will slow it down. It'll do something to alter the end result, the symptomatology. But it doesn't remove the cause in the first place. You see, nobody's immune from this. We live in a world where gravity is completely relevant, and every time we cause some type of imbalance in our spine, we cause more of a subluxation to occur, and more of an end result of that subluxation to manifest itself. Unfortunately, we live in a world where we're not used to treating causative realities. We're used to treating symptoms. We want to get feeling better as fast as possible at the risk of leaving the cause of the problem. Which leads me to these other two causes, which is the other two stresses. The emotional stresses, even though, again, they're very prevalent, if left out of control, the constant worry, the fear, the anxiety, can directly affect the function of the organs or glands, either causing them to overwork and eventually possibly burn out. The chemical stresses constantly poison the organs and glands of the system. And the organs and glands have to overwork to constantly detoxify and try to battle the effects of the chemical stresses. And in this scenario, as crazy as it looks, well, this is what's going on inside the body. The body is in some type of chaotic mess. And our paradigm is still on pills to cover up symptomatology. Now, if we leave this imbalance, this subluxation in the spine, and we don't get it corrected, over time it has no other choice but to get worse. And if it gets worse, that means there's more subluxation, more nerve interference, more symptoms, more malfunctions, more problems, more visits here, more tests, more diagnosis, and again, more medications. And that's very typical. The average person over 65 is on 2 and sometimes 3 medications, which to me is kind of crazy, especially if we realize if we do things natural in order to get well. You see, most of the time, chiropractors or anybody practices things that are natural, we're considered alternative. And I find it very bizarre that things that are natural and normal is an alternative to things that are unnatural and chemically poisonous. And let's think about this. If it's natural and normal to, to control our emotions or to eat better, if I had a rock in my shoe, it'd be natural to take the rock out of my shoe as opposed to taking a pill to cover up the pain caused by the rock in the shoe. So realistically speaking, what is natural and normal, which is not an alternative, it should be mainstream, would be, hey, get your spine checked for any neurological interference. Hey, change the way you eat. Hey, speak to somebody to help you manage through the emotions. And if doing all these factors, correcting the spine, eating right, exercising, and doing the natural things, well, if it doesn't work, then you can resort to an alternative, which would be medicine, to cover up the symptoms while we begin to still manage and correct the causative agents. So as a patient, if you come into the clinic, what I want to do is sort of step back from the picture, examine the balance of the spine, and see if there's any vertebrae that are out of their normal position, which we're going to find. It's not going to be, wow, I can't believe we found it. If you live on this planet, again, subjected by gravity and all the traumas that potentially can happen, if we find that area of subluxation, of neurological interference, our goal is to examine it, correct it, put you on a plan of action to restore normal position, movement, and function of the spine to allow the neurological system that designed the creation of your body in the first place, that causes you to work in the first place, to begin to freely move to all the muscles, organs, and glands and allow your body to heal. That is a natural approach. That is a sound and natural approach in order to be well. So I'm looking forward to you visiting us here at the Genesis Life Wellness Center. Of course, if you don't live in the New York area, I'll find somebody who has this mentality, has this thought process, and go for a consultation. You have nothing to lose to see if there's something that we can help you with to get well. Again, this is Dr. Viteri. God bless, and hope to see you soon.